From the News Channel 5 Network, this is OpenLine.
Hello everyone, welcome to OpenLine. I am Ben Hall. Good show tonight. We're talking about something that impacts a lot of people. People are living longer now, but that is presenting some challenges for people who have parents and they worry about caring for their parents. How do you keep them out of a nursing home? How do you find care for them? So many people have a story they can share along those lines, and we want to talk about that tonight. Very happy to have with us Neil Amrine, who can help shed light on this issue. I want you to call in with your story, and Neil can share his expertise. He's with All About Care, and we're happy to have him with us. And Neil, as we talk about this issue, as we talk about how much longer people are living, what are we seeing now? 100 years old is not as uncommon as it used to be, right?
Not at all. It seems that the 90 is the new 80, and 80 is the new 70. So with technology and medication, exercise, nutrition, people are definitely living longer, and the question is, what's the quality of life in between?
And for many people, they have parents that are living longer, and these are basically your clients now in many cases, right? I mean, the people that come through your door, what are you seeing? Who's coming through your door now?
Well, usually the folks that contact us, about 65% of our clients are between the ages of 75 and 105. Most of the time, it's their adult children who are contacting us. Could be a grandchild, could be another loved one who's an interested party, and they've recognized that their loved one may not be as safe any longer and home, and may need some companionship care or something of that sort. So unfortunately, it could be a compelling event. In other words, a hospitalization, a situation where a new diagnosis has taken place, a surgery, something of that sort. So a lot of times folks don't get on the front end of that, and they need to. And you can look at some signs of daily routine and habits that folks have, things that they used to do that maybe they're not doing as much anymore, and how do you continue that, that quality of life, giving them purpose.
And what you do, it's home health care, right? And I think we said in one of the shows before about what we're talking about tonight is keeping people out of a nursing home, keeping them in their own homes. So how would you describe home health care?
Well, probably two sides of home health care. I mean, generally speaking, there's the assumption of occupational therapy, physical therapy, speech therapy, so the medical component of what goes into home health care. What I'm involved in is the non-medical side, which is the assistance with activities of daily living. So it doesn't mean that you necessarily have to have a nurse come over to your house to help you put your pants on in the morning. You may need somebody who's just a compassionate, nurturing, honest, and hopefully very punctual individual that's going to be able to come over there and provide meal preparation, medication reminders, things that lead to that compelling event, that hospitalization, that acute setting. And so if we can kind of move the sick care system into a more of a preventative care community where we're being proactive and helping folks age in their home, I think that's the step in the right direction.
Because you don't always need, that's true, you don't always need a nurse. You just need someone, companionship, or someone to help with some basic stuff. Mm-hmm. and give peace of mind to somebody who's working, a child who's working and their parent, they don't know how they're doing. That's keeping people healthy longer, right?
That's right.
Just kind of keeping an eye on the parent. And so who is the client for you? Is it the child? The child is calling and saying, hey, take care of my parent, or is it the parent? Who do you report to, generally speaking?
That's a great question. So we have a lot of folks that are involved in the process oftentimes. The client is the end user, and of course that's what we design the plan of care, or the care plan, about their daily activities. They've probably been getting up at the same time if they've been living in their home for decades, and they have had the same routine, and they're having the same thing for breakfast. And so understanding their plan of care is what we're focused on. But the person who generally contacts us and the person that we're giving a little bit of respite to is oftentimes the adult child or the healthcare or financial power of attorney. So somebody who's maybe got some control and some interest in their financial affairs. It could be a neighbor, it could be a distant relative, it could be a spouse for that matter. Oftentimes, specifically the adult child is either going through an emotional component or time where they are either in denial or feeling guilty about how that care is being provided, and with other things in life that they're responsible for, they're torn, and so that's where we come in to help with that professional level of care.
And so how much, you probably see people that are really worried, right? That are in a great deal of anguish. They're worried, okay, I don't want my mom or dad to go to a nursing home, but I don't know what else to do.
Right.
I've got responsibilities. So the people that are walking through your door, what are some of the stories that kind of stand out?
Great question. So, we provide care in homes wherever they consider home, right? So the home could be living independently in the same place. It could be that you're living with your adult children or child. It could be that you're in an assisted living community, an independent living community. It could even be in a nursing home or a memory unit for that matter. And frankly, some folks spend days and even weeks per year in hospital settings. So if that's a home for a period of time, we often will provide companionship care and some level of relief and insurance. Oftentimes the eyes and the ears for the family. So the caregivers that we would bring in, or we would suggest folks to bring in, are jotting down and recording information about different events and giving, again, that respite. If you've got a loved one who's hospitalized, it's a very taxing, emotionally draining and physically draining responsibility when you're trying to figure out what's the next step. So it can also be as simple as, I no longer drive, or I'm no longer capable of driving. There's that event as well with the physician and the conversation about whether or not it's safe for that loved one. And transportation is a big part of what we do. It gives you, taking the keys away is a struggle.
And so you do that. So you all will drive around. If somebody needs to go to the hair appointment or the grocery store, part of what you do, this is something that's offered, right? The driving. So it's not just sitting with the person.
That's right.
But it's also not, a nurse or a doctor.
That's right.
It's companionship, and it's doing these basic things.
That's right.
And so do you think this is keeping people out of nursing homes?
I think it is. I think it's relatively new, that the idea of having a professional caregiver is a relatively new concept. Even laws as long ago as 35 or 40 years ago didn't anticipate that professional caregiving or professional home health aides would be a part of society that would drive down some costs and improve the quality of life. And it's certainly not for everyone, but it's also a go-between. It can be a negotiation, so to speak, of, we have seen folks that have left their stove on and put themselves in an unsafe situation, not just for themselves but also for their neighbors and other loved ones. They have animals, and so those can be great companions, but they also can be very difficult and a big responsibility, and that can be underestimated. So we can drive behavior and allow folks to take a look at what's the plan. What's the next 6 months look like.
What do you do if there is someone who thinks, well, my loved one could use this, but my loved one would not in a million years go for it? So in other words, you have somebody in your office who's saying, I want this for my mom or dad, but my mom or dad wants no part of it. And then you have to go in there. Somebody has to go in there and be with mom or dad who doesn't want them there.
That's right. Yeah.
So does that happen?
All the time.
Well, that's not good. That would be tough.
Not uncommon at all. Everybody wants to live with dignity. They want to live with independence. And so having the conversation, and that conversation comes, and understanding that it's going to be a struggle. It's going to be, very difficult. And so I'm a third party, and there are many others who own home healthcare companies that are third parties, and they don't have the history of what's happened and how mom or dad, got to be to this point. So sometimes, since I have no dog in the hunt, I can be a little bit more neutral, and we can talk through the routine and really talk about what we're looking for in the future, and also have them understand that their loved one is there to because they're concerned. They're concerned about their safety.
All right, we're going to take a break. And I want to encourage people to call in if you have a question or really a story that you could share that could shed light on what can be a very difficult issue for a lot of people. There's the number 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.